Welcome to the Power of Love show, sponsored by the DDJF Foundation, where we shine a light on loss and grief and how it impacts our lives. We are here to provide hope, resources, and a community so no one feels alone in their grief. Enjoy the show. Welcome to the Power of Love show, sponsored by the D.D. Jackson Foundation. I am T.J. Jackson, and with me I have my eldest brother, Taj Jackson.
What's going on, T?
What is going on, Taj? We are live on the Power of Love show. So if you are watching us either via Facebook or Twitter, we want to thank you for joining us. You can also be listening to us on our podcast, whether that's Apple Podcasts, Google Podcasts, Spotify, all those major streaming podcast platforms. We are there. We want to thank you guys for supporting our show. And remember to like, subscribe, do all that good stuff so we can help more and more people get help and the support they need. Saying that, we are not licensed therapists. We are just ordinary people who've experienced loss in our lives. We've been impacted by it and we've learned from it. And we here at DDJF Power of Love Show, we like to share our opinion in an attempt to help you overcome whatever it is you are going through. Saying that, if you need professional help, we urge you to seek it and find it. Do not just rely on us. There is our intro, Taj Jackson. Today's date is February 17. It's a beautiful day here in California, or at least Southern California. But it seems like the majority of the states is getting pounded by an unprecedented winter storm. And I guess I don't really have any clout to talk about it since I'm a California boy and I'm here in the sun. But we want to share, I should say this, we want to give support to everyone out there who may be struggling because of this storm. Many different cities, I have friends in many different places that are saying they are without power. And that is always a scary, dangerous, all those important things. So we want to send our prayers and love to you all. How, and here's the thing, Taj, we have we never usually talk about our guests, but we have a guest today, and I'm not going to give his name yet, but I think he may even have something to add because his specialization is on elderly. And I think when things like this happen, the lack of utility and power can really affect them even more so. With that said, though, Taj, again, we don't want to get too far into our topic just yet. I'm curious to know, how was your week?
I had to kind of cheat and realize every day is kind of lumped in together for me. But Valentine's Day was good. It's funny. I like Valentine's Day, but I don't like really celebrating online as much, just because for so long I was one of those people that didn't have a Valentine's, and so I know what that's like. I'm like one of those people that kind of think of the other person that doesn't have a Valentine's and has to see all the rubbing in that other people do, and so it's one of those things so I don't really post online about it as much.
I understand. That's a very valid argument.
It's like, but besides that, it was a good Valentine's Day.
Well, your younger brother kind of did the opposite. And for the first time, I shared a little family vlog of my Valentine's Day. And as much as I agree and understand your reasoning, I look at it this way. I have kids, and they may one day want to see what we were like for Valentine's Day when their parents were in love and all that good stuff.
Little capture moment.
So that's what I do on my family channel. Nice. I like to capture it for my kids, and of course for everyone who's following, subscribing to see our family. So, but as far as the day, it was, a great day. I saw some people say things that are very, make sense. They try to celebrate every day as Valentine's Day. They don't like to make one day specific, because then what's all the other days? So, regardless, though, we had a great Valentine's Day. We celebrated it a couple days early. We have young kids that had school Monday, so celebrating on Sunday didn't feel right. So we celebrated it Friday, and it was a good time.
Yeah, that's cool. Yeah.
Anything else you want to say, Taj, before we jump into our guest and our topic today?
Not right now. No.
All right. So today's episode of the Power of Love show marks part 2 of our mental health series. And we are honored to welcome an esteemed professional on today's episode, Dr. Vadim Baram. Vadim Baram is assistant clinical professor in the Department of Psychiatry at the St. Louis University School of Medicine and instructor in clinical psychiatry, Department of Psychiatry, Washington University School of Medicine. Dr. Baram is an adult and geriatric psychiatrist in private practice. He is the attending physician at SSM St. Mary's Hospital. Mm-hmm. Dr. Baram received his medical degree at Tartu University in Estonia. He completed his internship at Women's Hospital No. 2 in Kyiv, Ukraine. Dr. Baram performed his residency training with the Department of Psychiatry at St. Louis University. He also completed his Geriatric Psychiatry Fellowship Program at St. Louis University. Very, very credited, and I'm not even done yet. Dr. Baram has had extensive training during his residency and fellowship at St. Louis University towards long-term care. He is currently providing care in several nursing homes in the city of St. Louis and the surrounding vicinities. He is a member of the American Psychiatric Association and the American Association for Geriatric Psychiatry. He is a distinguished fellow for APA. Dr. Baram recently received an award from SSM Health St. Mary's Hospital Mission in Motion 2020. And that, without much further ado, ladies and gentlemen, Power of Love, let's please welcome Dr. Vadim Baram to the Power of Love show. Dr. Baram, how are you?
Thank you very much. Thank you for inviting me. And it is a pleasure to be a member of your distinguished society. And I will be happy to share some opinions on different subjects, what community interested.
Well, first of all, you are incredibly acclaimed. You have done a lot. And we, when I say we, our show, we've never had someone like you. And whenever we have someone unique and special, I love it because it's an opportunity for myself to learn and for our community to learn. My first question, first of all, congratulations on the award as well.
Thank you.
My first question is, what inspired you to go into the field of mental health?
You know, this is a wonderful question. Usually, this is kind of introductory question in any conversation. And I can tell you, I always was thinking why I really decided to become a psychiatrist. When we going to medical school, we all want to be doctors, surgeons, whatever, different other things. But probably from the middle of my medical school, I started to express interest in the mental health. I probably was not able at that time to clearly formulate what I really want, though I realized after my course in psychiatry that this is what I really like and enjoy. I was fascinated by the way how people thinking, by the process of thinking, why people come to certain conclusions and how people come to these certain conclusions. I also was wondering about emotions, what people experience, why people getting happy or angry or sad or frustrated, and how to control this, how to help with that part if people have struggled with these things. During my time of medical school, people were not very clear about some subjects what are very established right now. There were not that many medications available. Mostly it was available basically therapy, psychotherapy, what we called. However, I always was thinking that maybe if I go to advanced training in psychiatry and subsequently dedicate myself to the career of psychiatry, I may have some contribution to the field of medicine, to the field of psychiatry, where I think I can be fairly professional. And this is what I'm doing in the past 21 years here in the United States.
It's great. It's great. And I'm curious to know what inspired you to focus on the geriatric population. And before you answer that, I want to make sure, because it's kind of a tough word. Geriatric, is that just meaning the elderly?
You are right. To be more clear, American Association of Geriatric Psychiatry decided that geriatric, it is 65 plus.
Okay.
Basically, anybody 65 and below, considering to be adults, just for classification purposes. You know, nowadays, people live longer overall. And if before mean age in the United States was 65, then now mean age is 85. And we actually growing up in that area, and it is not a secret to see patient who is 99 years old and 100 years old. And it was just curious, I think, very funny incident there a few weeks ago when I came to the hospital doing around with my team. And sometimes when people coming to the emergency room brought by police, for example, unidentified, they put just number 100. And I asked, so how old really patient? And they told me 100. And I thought that they joking. So I entered the room, and it was very, very nice 100-year-old grandfather who was fairly clear in his mind, actually.
Wow.
And yeah, so it's frequently these days, and we see really very old people. And I really wanted to help this group of population because, as we know, a rate of Alzheimer disease and rate of different other dementias growing up. Why? Because baby boomers getting older, and it's a lot of people these days who reach above 65 years old, and unfortunately memory problems becoming more and more pronounced in this group of population. There is not that many medications available to deal with these problems. And to tell you the truth, I decided to go to the field of geriatric psychiatry inspired by my teacher, who was actually here at St. Louis. He was at that time president of International Psychogeriatric Association, Professor Grossberg. And he really taught me a lot, and I learned a lot of options how we can assist our growing community and elderly people. And this became a very serious part of my future career. While growing here at St. Louis and getting more knowledgeable and increasing my practice and expanding my practice, I decided that I would not focus only on adult population, but also on people who requires more and more attention, and at the same time very vulnerable. And that's basically was the idea.
Okay, so I have, from that response, I have several questions, and I have a list of questions but one question I definitely have is, and this is kind of a selfish question, but I apologize, but I think a lot of people may relate to this. Alzheimer's runs in our family, and for anyone who maybe has dementia or any other type of Alzheimer type of disease that runs in their family, What would you advise us who are in our middle age? Is there anything we should be doing or can be doing as a 40-year-old, 45-year-old, or 50-year-old who we don't think we're experiencing anything, but just to be on the proactive side? Is there anything we should be doing if we know it runs in our family?
Excellent question. Excellent question. You know, you may treat this concern from different prospects. You can be more aggressive and less aggressive. Knowing that disease running in the family, there are genetic testing available at this time. And if disease connected to genes, to dominant chromosomes, I think that you have chance to check through genetic testing and, let's say, get estimation that probability of the disease after a certain age will be 80%, for example. If you ask my personal opinion, at this point, I would not do that. However, awareness is very important. You train your memory. Observation shows that the more you train your memory, the more you avoid some negative impact on your memory, like, for example, alcohol or drugs, you know, some substances what you don't want to obscure your memory. You have chance to postpone the development of the disease for quite a long period of time. At this point, we cannot prevent the disease, but we can delay the disease. At the same time, living in 21st century, there is expectation that new group of medications will be on the market shortly. I hear few medications just about to join the market. So if you in your 40s, I want to say you have another good 30 years not to think about it. By that time, it could be actually genetic surgery where determinants of potential of Alzheimer disease may be excised from the genotype.
Wow.
And, I honestly would not scare yourself and your loved ones that honestly that this is gonna happen. You know, you kind of reminded me just recently. I was dealing with family who is suffering from Huntington disease. I don't know, did you hear that or not? But it's very detrimental disease when people kind of shaking over time and then basically cannot control their functions and they getting ill very early. And of course, the probability of that type of disease, like 90% penetrance in the generations. So the question is, if you know about it, how this will impact your life. If you feel all right, you know, I think that I advise people to honestly enjoy the moment. But also going back to dementia and Alzheimer disease by itself, I think that knowing is very important. Make some efforts again to train your memory. What you're doing very successfully is also very important part. But I don't think that I personally would not go to that.
Doc, when you say train your memory, is there like a specific thing? Is there something we should do?
Well, you are reading, you listening news, you participated actively in the news, you doing active mental activities. You know, passively participating into some actions and basically eating, sleeping, doing nothing else. So you live your life. You very multifactorial. You spend time with your children, with your family, with your spouse, with your brothers, with whole foundation. So this
Stay active.
stay
Yes.
active. Yes.
Beautiful. Okay, so here's a question I had that was written out. You have worked extensively with the geriatric population. How is COVID affecting our elders, and what can we do to support the seniors in our own lives?
Yes. COVID unfortunately impacted all of us, all spheres of life, all ages, and all people, regardless who they are, in negative way. Especially elderly people who are so vulnerable to any type of diseases, and specifically with COVID. It is not a secret that we lost a lot of elderly people during the peak of pandemic. At some point, I remember that me and my team attended nursing homes, and we saw basically drop of the population of the nursing facilities drastically by 25% or more. People were dying right and left, regardless it was East or West Coast, Midwest, anywhere in the country. Subsequently, we found ways how to deal with the consequences of COVID. It's not the problem by itself getting the COVID. The problem how we deal with the consequences of COVID. And probably everybody, you, our audience, remember where people basically ended up in ICU, where there were not enough of machines in ICU, and a lot of people went on ventilators, and it was very rare when people were taken off ventilators. These days, with availability of few options like immune cleared antibodies and steroids and some other different medications, we basically limited now negative consequences. Here I hear less and less severity of the disease, so people able to tolerate the disease basically much easier, though again weakness, complications with the breathing, smell, and multiple unknown complications still possible. In terms of elderly people, because they are usually suffering from multiple medical problems like hypertension, diabetes, congestive heart failure, kidney problems, etc. This has negative impact on the well-being of the elderly people. At the same time, we learn now how to deal with the disease. Availability of vaccine getting more and more eased up, and elderly people were in the first line of population who need to receive vaccine, which definitely reduced dramatically potential of the disease for the future. But right and left, we still hear that people getting ill, getting pneumonia, and people getting temperature, etc., etc. And these, but again, at this point, we are welcome to the nursing facilities. We resume our face-to-face communication with the patients, which was restricted for a period of time, and nursing homes basically were isolated islands. There were no entrance and no exit from those places. negativity of whole COVID situation, that families are not allowed to visit elderly people. And you know how important contribution of the family members to the well-being of people. I see this over and over time, that these poor people who are residents of the nursing homes, who are ending up in my acute unit in the hospital, uh, they getting disoriented and depressed significantly, just because they don't see their loved ones, they don't see their children,
Mm.
significant others. And isolation, social isolation and loneliness, this is a very important negative impact on the mental health of our elderly population. I encouraged families of the elderly people who are currently in the nursing facilities, assisted living facilities, any type of community facilities, please support your loved ones. This is very important for them to live longer, to be with us a little bit more than they can be. So I strongly support that part. And again, my team, we're spending an enormous amount of hours and time to help those people. For some of them, we becoming their families. And,
Mm.
we feel bonded and connected to our patients. Even people with advanced dementias still can recognize somebody who they feel comfortable or not. They may not remember your name. They may ask you, "Who are you?" multiple times, but they feel comfortable with you. That's
Yeah.
very important.
Well, thank you for all of that. And I was, that was my next question. You kind of answered it, was how does loneliness affect a person's well-being and overall health? And it's obvious loneliness isn't a healthy thing for everyone. But I have to assume, and you correct me if I'm wrong, Doc, that for the elderly, it's even harder for them because they mentally appreciate family and people more so as they get older. I feel like that's what's happened to me. I've appreciated my family and being around people every year I get older. So I can only imagine what it's going to be like when I'm in my 70s, how important people are going to be to me. And I can only imagine what COVID has done with the isolating of elderlies to our elder people. So my question to you is, have you seen like a spike in depression amongst elderly, or even suicide? And again, is there anything we can do to help our elder not feel that loneliness during this time?
Excellent question. Each of your questions are absolutely incredibly important. And our audience, I hope, may agree or disagree with me, but at least we will address this question because, yes, loneliness is a significant problem. And question what to do about it. Yeah, we all need human touch. So absolutely correct. And that's true. And I do have some patients, and we're doing telepsychiatry more these days than before, who basically have me as the only person, live person who talking to her, who she communicate. And there's not only one patient like that. And I'm paying attention now more and more that because of COVID, because of limitations, because of different illnesses, people limited in their ability to ambulate, to go anywhere, to attend some places. And they have very limited amount of people who support them. For example, if before I saw patients once every month, every 2-3 months, this group of people, I'm going to communicate like every week, for example, or every 3-4 days, depends whom I'm dealing with. Uh, you know, um, yeah, Yeah, yeah. That's true. People feel so isolated that any communication, any friendly communication, um, any introduction into some real world probably will keep people up. Rate of suicide increased
Mm,
in the past year. Um, it did not impacted me directly, though I hear that this happening in more instances. Unfortunately, people have problems to deal with that. People cannot. People are very social subjects, basically.
mhm.
People cannot live just by themselves. People getting depressed. Yes, rate of depression exponentially went up. Depression, anxiety, different other what I call affective problems, more pronounced these days than was a year and a half ago, approximately. Uh, we are working. I never stay at work that late what I stay in the past year. And I have a group of very good professionals working with me, very dedicated people. And we just stay as long as people need us. And it is when somebody asks me, so how late you working? We're telling we basically start around 7 and unlimited,
Wow.
unlimited. And our families already kind of decided that it's okay. My daughter talking to me on FaceTime because I'm leaving when she is sleeping. I'm coming when she is sleeping,
Yeah.
and only weekend when I'm able basically occasionally to see my children. So that's a problem. But yes, we on the side of our mental health professionals, we are trying our best to assist our elderly, and not only elderly people, to everybody.
I have another question. I know one of the things that's the most challenging thing for, I think, our community, or at least what I can think of for me, um, for our age group, would be when to determine when nursing home or elder care, or some type of external care is the right choice for our loved elder ones. Do you have any advice on when we should be going that route or when we shouldn't be going that route?
My opinion. It's only my opinion, and it may not reflect a general opinion of professional societies. United States, as it is like united country, a lot of immigrants here, either first, second, third, or whatever generation. We came from different inheritance, and different people have different opinions how they want to deal with their elderly people. Personally, I would keep my parents uh, home as long as they can.
Mhm.
Let me tell you that. I think that they pay their dues at some point of my life, and now it's
That's
time.
beautiful.
You know, but I see different points of view, and I see people go at some certain age to the nursing home. What I usually advise my patients or families, I think time to go to the nursing home, assuming that that people have enough support. Time to go to the nursing home when family, significant others, spouses, children telling, I cannot do more than I can.
Mhm.
I just physically cannot do this at home. And sometimes I have to tell this statement to the families, uh, despite the fact that I am pro home observation. But sometimes it is just impossible because dementia changing mind of people. Unfortunately, um, gray matter, or this substance, what we are thinking, it's shrinking, and there is no enough substrate to process information um, properly. And yeah, sometimes it's just impossible. But I think that in all equal, yeah, if you have option, yeah, they need to stay home as much as possible. You know, again, people are different, options are multiple, but we all have our mind. um, so it's a personal decision, but I think I when I'm dealing with my elderly people, I am dealing with them like as my family members. I
Mhm.
really, I'm sick. I basically getting through all this illness together with them. Um, I understand them very well, and I understand sometimes, not sometimes, always, is families who desperate talking to a doctor to ask what's going on with mom or dad or somebody significant others, because it is very difficult to deal with the disease. People are not informed about the disease, and you know, the way, unfortunately, how disease progressing. And I'm not talking about only Alzheimer dementia, because it's common way of thinking of people that when dementia it is Alzheimer disease. I will tell you and to all audience that dementia has very wide umbrella. It may be multiple modifications. People may hear about vascular dementia. It means when people suffer stroke or several strokes, and unfortunately, in younger age, they may have significant memory problems, getting demented. People may suffer from so-called Lewy body disease. Lately, it's becoming more and more often, and again, multiple different sub scales of different dementias. But regardless, if people suffering from dementia, then their ability to process information impaired, and it takes about 3 years until families bring their loved ones to the attention of doctors. Because
Wow.
if you look to the big book of geriatric psychiatry, you will see the pattern that if people ending up in the doctor office, in the psychiatrist or geriatric psychiatrist office, it's about 3 years from the beginning of the disease, because it's coming insidiously. It's coming kind of without warning. People will not come and tell, "Hey, I have dementia." You know, sometimes
Yeah.
family started to pay attention. You know, you misplace something, and it's okay to misplace glasses or whatever, or some actions, or you lost something, and some warning or non-warning signs. People may not pay attention up until certain point, that accumulation of issues coming to the point when you need to talk to professional. And I encourage, don't be afraid to go to see psychiatrists. It's
Mhm.
okay. We're not biting. Normal people. We are listening what people saying, and we are trying to help. The earlier we see the problem, the earlier we can interfere. You know, if even with the currently available limited medications, we can delay worsening of the disease. We cannot cure the disease, but we can delay. There again, few medications available which may postpone the problem. Not a lot, but by 6 months approximately, which is also
Yeah.
important
I,
time.
I thank you for saying that, because I think that that does need to be clarified. You can't necessarily cure the disease, but you can delay it. That's important to know. Is there anything else you think we as a society, as the mass population should know about elderly and the mind, or elderly and their mental health? Is there something that we aren't paying enough attention to, or that you think we may be not understanding properly?
Elderly people, as everybody else, has the same emotions and the same abilities as adults, what I want to say. Please respect your elderly, love them, provide them with help and support. Remember that at some point they were young and assisted you in their lives. Try to be nice children for your parents, grandparents, and your relatives. Be their friends. Remember that they are smart and wise, and don't minimize that if they forget something from the current events, that they remember everything from the past. And people with dementia may not remember what they had on breakfast, but they will tell you what happened 50 years ago.
Yeah.
Listen their experience. Remember that they may tell you some very valuable aspects, even though they classify it as having dementia. They still have very important points what they can transpire from generation to generation. So value your elderly, respect them, and don't give them up. That's my advice.
I love that, Doc. I really do. That's something we were raised on, my brothers and I, to respect our elders. And as I've gotten older, I've learned that their knowledge is gold, and that we should listen to our elders, and their experiences is one of the most powerful things we can lean on. So I have so many more questions, but I'm looking at the time. We're already past 40 minutes, and I no, it's okay. You gave us so much great information. Yes. Taj, I'm sure you had questions, but I'm sorry if I took your questions too. But I did say this to you before we even started, Doc, that we like to close our shows giving our guests up to a minute to talk about whatever they want to talk about. So I want to start that minute now, and the floor is yours, my friend.
I appreciate it to everybody, to DD Jackson Foundation for this opportunity to share my points of view on the mental health in the United States, and especially elderly population. I wish everybody to have a great health, to stay safe and healthy. And thank you to everybody who's staying with us today and who will listen our show when it will be on recording. But I want to tell everybody, united we stand. We will stand this pandemic. I hope it will be over shortly. With the rate how vaccine is going, I expect personally that by summer we will be, most of us will be vaccinated. Don't be afraid of vaccine. I did both on myself. I am fine. My mother was asking me, how are you? I said, I'm good. I'm okay. No problems. So don't be afraid, and I hope we will go back to normal lives very shortly. Thank you, everybody, for your attention.
Beautiful. So I do want to say Dr. Baram has an Instagram at Baram Psychiatry, and the website is www.baram, BARAM, Psychiatry. So barampsychiatry.com. And again, you were fantastic, and I truly appreciate you joining us. Again, I think you are our first doctor that was here to discuss the elderly and mental health. So I just want to thank you for joining us today. I learned a lot. I know my brother did, and I know our community did. And on behalf of our entire foundation, Dr. I want to thank you for joining us.
Yes.
Thank you, everybody.
All right, so we are going to close the show. We will see you guys next Wednesday for another show. We want to thank you and bless you all and have a great rest of your week. Adios and take care.